Salam Nantehon. Peace be upon you. Today I am closing out the ER series, and you know that over the past few episodes I shared Mom's latest ER experience, what sharing her story revealed, specifically some patterns that came out, and some practical things that patients should know when navigating the ER. And the more that I reflected on the story, the more I realized something important that I previously missed, which is that there were so many people present. Of course, you know, there was my mom and my aunt and the nurse who started all of this, the one to whom I spoke in the first video. But there were also several nurses rotating in and out of mom's room. There were other patients and their families nearby, and then there was the security officer, and that got me thinking about bystanders. Because sometimes when a moment starts to escalate, the person who has the power to change how the story shifts isn't always the patient. And it's not even the person who is upset. It's sometimes the person just standing nearby. One of my mentors, Dr. Nancy Weaver, is a public health scholar and impressive founder of an initiative called Support Over Silence. And she's done some amazing work helping communities understand how bystanders can step in during stressful public moments. And her work specifically focuses on parents and children in public spaces, but Dr. Weaver's principle applies far beyond that context. And actually, we touched on parent child dynamics last week, and so it's interesting to see how it's coming up again this week. And the idea behind Dr. Weaver's model is really simple. It's that when someone is overwhelmed, judgment is rarely going to help, but gentle support can interrupt escalation. Her framework emphasizes small actions that create space for people to reset, as she puts it. Things like showing kindness, staging a distraction, a direct offer to help, or bringing in more support if the situation calls for it. And those actions may seem small, but they can totally change the emotional temperature of a situation. And when I replay mom's ER experience, I realize just how many opportunities there were for that kind of bystander intervention. Specifically, several nurses were rotating through mom's room right before her untimely discharge. And as you might remember, mom kept saying, "Please, can I speak with my doctor?" And at one of those times, someone said that they would go tell the doctor, but instead of the doctor coming in, another nurse would rotate in. And that pattern repeated until the situation got out of hand. And eventually, the final interaction between everybody included a lot of shouting that was loud enough for other patients and their families to begin peeking around the corner to see what was happening, which was another key moment when a bystander could play a really powerful role. Another nurse could have said, "Let's slow down. I hear that you want to speak with the doctor. Let's get that taken care of." Another patient or family member who overheard mom's experience could have gently redirected attention with something as simple as, "Is everything okay here? It sounds like things are really stressful." And even the security officer, who later showed compassion privately, might have had the ability to step in earlier with words like, "Let's take a breath. Let's make sure everyone feels heard before we move on." And none of those statements judge or attack anyone, but they do shift the moment and they open the door for repair. One of the most painful things about mom's experience is that so many people were present, but no one interrupted the escalation. And it's not because people don't care, it's often because they just don't know what to say. And Dr. Weaver's work reminds us the goal of bystander support is not to change the situation, it's just to create a pause, that reset. And in healthcare, this can introduce a moment where dignity can come back into the patient's room. As I shared my mom's story publicly, the responses from you all are shaping the following episodes, including this one. And one friend and mentor wrote to me about larger structural pressures inside healthcare systems. This person wrote, bed shortage or bed shortages are what we get when healthcare is treated as profit. Insurance reimbursement pressures force hospitals to move patients through quickly just to break even. And that observation raised a bigger question for me and that I would pose to everybody, to all of us, which is, should healthcare keep working mostly like a profit driven system? And it's a really, really tough and messy and complicated question, but it's one that deserves super thoughtful and sustained conversation, because when hospitals work under intense financial pressure, that stress doesn't just affect administrators. It reaches all kinds of healthcare providers and clerical staff and patients and caregivers. And now, as you can see, the story is trickling over to you. Everybody is feeling it. Another message that deeply moved me came from someone who had spent years caring for their own family members. They wrote, every time my mother and brother were hospitalized, my sister and I stayed by their side. We noticed that patients who had advocates were treated differently than those who didn't. And that comment was so hard for me to sit with, because it reminded me that the quality of care someone receives can depend on whether they have someone advocating for them. But it also reminded me of something else, which is that caregivers play an extraordinary role in helping people navigate systems that are often difficult to move through alone. Many people are quietly doing this work every day. They're helping parents through medical appointments, they're managing medications, they're calling insurance companies, they're coordinating transportation, they're translating medical terminology, all while juggling their own jobs and their own families and their own responsibilities. And that invisible labor deserves recognition. It deserves better system design as well, not just recognition, because you should not have to have someone with these heroic navigation skills just to receive basic healthcare. And I want to say something really important here, which is that not every system is standing still. For example, my mom recently returned to a facility we hadn't interacted with since about 2020, and that's Kaiser Permanente. And we were so pleasantly surprised to notice a lot of improvements and changes in care coordination. And I want to say no system is perfect, but betterment, no matter how slow or how small, is important. As one of my favorite thought leaders, Brene Brown, often says, the goal is progress, it's not perfection. And one of my new friends also reminded me of something super important, which is prevention. It's the thing that I was trained to think about the most. This person is deeply committed to strength training and physical health, something that I greatly admire and aspire to. Strength training is one of the most powerful ways that we can protect our long-term health, especially we women as we age. But not everybody has access to gyms or fitness resources. And don't even get me started on whether or not people live in safe enough neighborhoods to get outside and move, which raises another systems question. What would it look like if insurance plans partnered with community gyms to expand access to preventative health? These are the kinds of conversations that are going to help us move toward human flourishing, not just crisis response, because eventually every single one of us will interact with the healthcare system. None of us are exempt from this. And at some point, all of us will also need care. And we don't want to assign blame, but we want to be part of building systems where dignity and compassion and accountability are the norm. They can coexist. Before closing this series, I want to give a shout out to someone who shaped how I approach painful experiences, and that's my father. He taught me so much more than I can say in a short advocacy video, but I'd like to highlight something especially profound that I learned from him about resilience in community. As I mentioned in the very first story, mom survived unimaginable trauma throughout her infancy and childhood and adolescence. And in fact, she had to leave everything she knew behind to escape someone literally threatening her life. And after months of trying to woo her unsuccessfully, she finally opened up to my dad when he probed more deeply and wanted information about why. And when he learned about her story, he responded without any hesitation. If the bullet that you think is coming for you comes, it's going to have to pass through me first. And I trip over my words just thinking about it because of how much it moves me. And that moment changed her life, and it clearly changed mine. You probably wouldn't even be listening to me if he had never uttered those words to her. But importantly, Dad's response showed me the power of standing beside someone, especially when they feel the most vulnerable. And that is what bystanders can do. It's what caregivers can do, and it's what communities can do. And Dad, I don't say this nearly enough, but I am unbelievably proud of you. And you could not begin to measure how grateful I am for all the ways that you've protected and provided for your family. And you truly inspired Alchemizing Stories, which is where we turn pain into purpose. And if any part of the story today resonated with you, I invite you to engage in whatever way feels right to you. You can share a story, you can share a lesson, you can share the video that moved you most with someone you think might want to hear it, because change rarely begins with institutions. It begins with us, the people who are trying to navigate them. Salamat Trivza. May your peace overflow.